Good evening, everybody, and thank you so much for joining us for our College of Health student panel. I have four amazing current students of ours, ranging from so many different types of disciplines in our College of Health. I know that you're very excited to hear about them. Let me go ahead and briefly introduce myself. My name is Geronimo Para. I am an outreach counselor. So if any student has any questions with regards to admission, or about choosing their major or anything back of house, I will be on after today's Q&A panel with our students to help you with any questions, and I can be reached out outside of our evening session today too. One other thing I do want to mention before we begin with our talented students is this one-time event that is actually coming up in the next few months, and that is, as you can see in this QR code, is our Admitted Student Day. So if you haven't done so, feel free to scan this QR code, or if you're watching this, pause this video and scan this QR code to join us on Saturday, April 25th for our Admitted Student Day. So you're welcome to bring mom and dad, the family, your friends, or whoever you'd like to go ahead and get those resources, meet some of our student panelists or some of your future professors, advisors, and other support staff on your beginning of your pioneer journey here. But without further ado, we will stop sharing and stop listening to me. I would like to go ahead and pass it off to our amazing students. So I will go ahead and let everyone introduce them. So for my students, go ahead and say your name, where you're from, and your major in. Just give us a good intro to who you are.
Hello, my name is Hannah Persima. I'm a nursing major here. I'm in my last year of my nursing program, and I'm from Dublin.
Hi everyone, I'm Leilani Randolph. I'm a kinesiology major. I'm a fifth year student actually. I'm in my second to last semester, and I'm from Oakland, born and raised.
Hi everyone, my name is Ariana Urias. I'm in my third year and I major in speech pathology and I'm from Richmond.
Hey everyone, my name is Jordan Harris. I am majoring in social work in my bachelor's. I was born and raised in San Francisco.
Thank you so much. And for all of our prospective audience members, as you can see, we have a bunch of different represented majors. So feel free to ask any types of questions that you may have at the end, but you'll definitely hear a lot about different perspectives and different students. And for my graduating seniors, congratulations. I know you're almost there at the finish line. Let's go ahead and begin with our questions. So my first question for our panelists, what made you decide to pursue your major?
For me, nursing has always been a big part of my life. It's kind of like a lot of people say that, a lot. I'm Filipino, so a lot of people say, oh, a lot of Filipinos are nurses, and it's kind of true. Like for me, a lot of my family, they're all nurses. My mom's a nurse, and she's always been the one to really encourage me to do nursing. And then when I was growing up, my dad had always been kind of sick, so just learning how to take care of him as well really enforced nursing as a career for me, and I I'm glad I pursued it.
For myself, what made me decide to pursue kinesiology was a general love I have for movement and physical activity. I actually have had a couple of majors before kinesiology. I was an art student and then I was a psych major. And so, as I was moving from psych to kinesiology, there were a couple of kin specific courses that I took. Beginning weight training was the first to reignite my love for movement. And then Introduction to Kinesiology gave me some core concepts that I was able to apply to some of my favorite interests. One of the interesting things I learned in that class was imagery, but I applied it to the context of the anime Baki. And so there's this moment in which Baki's visualizing his opponent's fighting styles as he's practicing shadow boxing. Being able to overlap my love for psychology, fitness, and anime, that's what really helped me find a place in kinesiology.
For me, my cousin, she went to speech therapy when she was younger, and so seeing like that effect on her developing speech and improving communication between like my whole family, it really inspired me to look into speech therapy. So I did my research and then I looked into it, and I decided it was something that I wanted to do. So first I went to community college. I majored in psychology. It's kind of like an entryway, and then I transferred to East Bay and been doing my major classes, and it's been pretty interesting.
For me, the reason why I chose social work, just me growing up in child protective services, I just always had a passion, to be able to give back to that community, be able to help them, for they can be able to learn how to navigate the system. So, it's just something that, that I'm willing to do, I'm ready to do. And I just have a love for it, and I'm just ready to get to it.
Awesome. Thank you so much. Jordan, I'm gonna be honest, you really almost made me stand up. I was like, oh, let's go to it for real. Awesome. Thank you so much, everybody. My next question, which class or classes have you enjoyed the most so far, and why is that?
For me, for those who might not know, East Bay has its own nursing program, but before you get into the program, you have to do prerequisites to get into the program. So for prereqs, my favorite class was microbiology. It's a really, really tough class, and it took a lot to learn how to study for that class. It first taught me like how to study and know like good studying tactics, but also I was really interested in it because it's such like a different world from things like anatomy and physiology, like and how like the body works. These are things I've never ever heard of. Like I've heard of E. coli, but I don't really know what that means, like in terms of microbiology. So I thought that was really interesting. In my program, my nursing program, so far I really liked my psych course. This is the first like nursing class that you take in our program, and it really teaches you how to just talk to people. Because one of the first interventions that you do for patients is you just sit down and you have a conversation with them. So I think this class was a really good foundation for that. And then also I really liked our med surg class, which is it's kind of where we learn all of our like really like nursey things, like where we learn about like heart failure, diabetes, kidney disease, all those different types of pathologies. And yeah.
For myself, I've enjoyed a great degree of pretty much the entirety of my kinesiology major. However, a few of my class highlights would be applied musculoskeletal anatomy as the first. There's a program that we use within that class called Muscle in Motion, and it allows you to see exercises in action. You get to identify primary and secondary muscles used within any given action. There's narration explaining what the actions are, how they're performed, and then you also get to see to the side the bones that the muscles cross, the joints and everything. And so you end up seeing the origin and insertion within that. And applied musculoskeletal anatomy further reinforce just how many muscles the body actually ends up recruiting to perform actions that personally I take for granted. So it was very cool to see just how much of a powerhouse the body is in that dimension. And then I've also really enjoyed exercise physiology because of its practical applications. One example would be understanding how oxygen consumption or VO2 indicates fitness level and how we can tell which fuel source a person's using between fats or carbohydrates. And ultimately, my kinesiology classes have been challenging, but they're rewarding as they're helping me get my study habits in order.
For me, I have one unrelated to my major and one related to my major. The one unrelated to my major was a Peoples of Central America class. That one was really interesting to me because I've never really gotten a chance to learn about Central America, like in school, mostly just Mexico. So it was really interesting to see how the wars developed, especially because I'm part Salvadorian. So that was interesting. And then a class I'm taking this semester is for phonetics. That one is really interesting to me because you really get to see how the sounds form a word, and how there's like really similar sounds across all languages. So seeing that form has been pretty interesting.
And for me, I enjoyed all my social work classes, but the two that stand out for me was first one is social work 325, and that's writing in social work because it be able to teach you how to write like a professional social worker. Be able to for you to learn how to be able to do case notes and documentations and reports for courts or agencies, assessments, client summaries, learning professional communication, clear and unbiased writing. And then my other one was Social Work 305, which is careers in social work. And that one is, it figures out what kind of social worker you want to be. They have different career, paths like, child welfare, juvenile justice system, mental health, school social work. So many different, programs that you can be able to, attend and your internships, be able to learn that experience and be able to get those hours where you can be able to, move on and become, a licensed social worker. So, them was the two that stand out the most to me.
Thank you. And I don't know about our audience, but I could really tell our panelists are really passionate because for some of them, at some points, I didn't understand a lot of the words, but I could tell they were part of the major that they were in. So thank you very much. And we saw the passion in all of your responses. My next question, how have your experiences with the faculty, so the professors, and how have they been? And if how are accessible, excuse me, how accessible are they outside of class? And if anyone wants to share a moment where a professor really was able to support you.
For our nursing faculty, I could not like praise them enough. They're very, very excellent here. I always feel supported in my learning from our nursing faculty. They really work hard to support like our learning and like our understanding, but also understanding that we have lives outside of school. So they really try to work around our schedules. Of course, there is a set schedule, but they understand that many of us have families, we have like jobs, we have things outside of school. So they're really good at like accommodating and understanding for things like that. Um, a lot of my professors, they just gave us their phone number, which I think is really cool. Said they always know that text is always like a lot easier than an email or even just Canvas messages. So they always just offer up the number, and it's always super super easy to reach them. I've never had any problems about if I was struggling in a class, just being able to talk to a professor straight up and saying like, "Hey, I need help," and they always make the time to sit down with me and just help me understand like whatever we're learning. Yeah.
That's amazing. I have similar high praise for the kinesiology faculty. I've had wonderful experiences within the department. Everyone within it is deeply supportive, and they're all very student focused. And so every single professor I've personally worked with, they've all been fairly easy to reach, whether you just pop by during their office hours, see them just walking within the hallway, they'll always stop to say hi. They're very accessible. And so I do within this want to give a shout out to my direct faculty mentor, Dr. Mai Feng Jinio, as she is one of my biggest champions, and there have been several instances in which she supported me. I can begin to summarize her impact in just simply saying that she's changed my life, but particular to an academic context, or I should say, in an academic context, Dr. O is the reason why I am actually a Sally Casanova scholar, or a Sally Casanova scholar, and I received a scholarship that, for instance, enabled me to travel to SoCal for the weekend to give my first ever oral presentation. And I delivered that at CSU Fullerton. And then a recent update I can give is that actually I just got a provisional award to go out to New York for 2 months and do summer research there, fully funded. And the only reason I have that scholarship is thanks to Dr. O.
Just want to say congratulations on that. That sounds amazing. For me, my all of it because the SLHS major is like relatively pretty small, all our professors are really understanding, and you have basically all the same semester, all same professors um throughout your education. So like you really get a chance to know your professors, and they're really, really receptive to any criticism or things that are not working. Like they're really adaptive to that. Or if, let's say, an exam date needs to be pushed back because you haven't covered, or because we haven't covered as much as we would have liked for a topic, the my professor, Dr. Galitzu, she's pretty receptive to pushing exam dates back, and so that's pretty helpful. as well as our major specific counselor, Dr. Higby. She's really supportive. I went to her this semester actually. I signed up for 6 classes initially, but I decided that I couldn't handle it. So I discussed with her some options, what it would look like to drop a class or not to drop a class. And she was really supportive and assured me that nothing bad would happen if I dropped one of my classes. So I ended up doing that. But everybody, you really get to know your professors, which I really love. And they're all very supportive and receptive.
I'm going to start off with giving the whole faculty department of the BSW shout out because this is a new program, to the university. And, they've been trying, their best to keep up to make sure, us students, is getting the support that we need. It's been a lot for them, and I just want to, give a shout out to them, and just, thank, them for just, being flexible with us students, is being there, and just supporting us. But I also want to, give a shout out to JP, as you guys know, Dr. Horn. Um, he, is always there, always supportive. Anything that I need, any type of support, when I go to him, he's just on it. He asks questions. Hey, how can we get this done? Let's do it. He has been there, just looking up to him, because we have similar backgrounds. It's just amazing, to just have him, as a teacher. Just all my professors, I want to thank you all because they all are so flexible and, are so supportive to all of us. So thank you guys.
Thank you, everybody, and congratulations, in specific Leilani, with your scholarship. Amazing. My next question, are you involved in anything outside of the classroom? This could be something related to academics, research, internships, clubs, organizations, and how has that helped you in your major?
For me, outside of the classroom, I'm part of our nursing school board. So it's called East Bay Student Nursing Association. For me, in that role, I feel very rewarded with what I do. My job on that board is to help students who are just starting their nursing program. So being able to just talk someone through maybe like how to study or, how to balance their life when they're first starting off their program is just super rewarding to me. Also being on that school board, it helps me or it allows me to talk a lot with faculty, which I think is super helpful. It helps me also communicate between students and faculty, seeing where everyone's heads are at. So that's something that I really enjoy. Before I got into the nursing program, I was actually a volunteer at Eden Medical Center in Castro Valley. And it wasn't like anything medical. It was more like I'm pushing patients to their room, or I'm pushing patients in the wheelchair to be discharged, or I'm helping patients find to where their appointments are. And even though it wasn't like hospital, like really like patient care related, it taught me how to first talk to people, like learning how to talk to patients or just people in general in that setting of a hospital. So that was super beneficial to me. And also, if people are interested in applying to our nursing program, it really looks good on your nursing application just to have some volunteer hours. So I would suggest that before you apply to our program, our nursing program at least, try to get some volunteer hours done.
Thank you, Hannah, for your time volunteering and also for supporting your peers. That's amazing work that you've done in both aspects. For myself, I'm rather involved in research. I've also been a part of clubs, and I am a member of the Ever Forward Club. I was previously a member of the English Majors Club. And actually, as part of the kinesiology degree, at least at my time of enrollment, there was an internship component. And so I was able to serve upstairs in the PE building at Get Fit, Stay Fit and be a personal trainer to staff on campus. I am actually leading the group boot camp classes on Fridays through Get Fit, Stay Fit as a student assistant. So that's all been amazing. Going back to research specifically, I'm actually a part of the Opportunities for Student Scholarships, Creative Activities, and Research, or OSCAR program. And then, as previously mentioned, I'm a Sally Casanova Health Profession Scholars Initiative, and that's part of the California Pre-Doctoral Program. Research ultimately has allowed me to improve my public speaking skills. It's allowed me to travel for work, which is an experience that I don't think I would have had as soon as I've had it otherwise. And then through research, I've also developed writing and critical thinking skills. I've really begun tapping into my nerd brain, as Dr. O and I will often discuss within our research meetings. And then another thing that I'll mention too in terms of travel is that actually I'll be going to Chicago for the first time in April, and that's thanks to my research involvement.
I do want to say that sounds super amazing. Um, Congrats for going to Chicago. For me, I'm in the NISLA club, so that stands for the National Student Speech Language Hearing Association. I'm a junior representative, so I just make sure that the voices of SLHS junior year students are heard, and that to make sure that there are events for them. And yeah, I mostly do like the event flyers. I send out the notifications for when the events happen, and there's four other junior reps, so we come together and plan these events as a whole to make sure that there's fun things to happen on campus and that there's like an established community across us. Also, last semester I did the Pioneer Pals summer camp program, which was basically a summer camp with kids from, I believe it was like 7 to 10, I think. And we basically, they had like disorders of some kind. So, like, they were using AAC devices, or they were nonverbal, or things like that. And so that was my first exposure to working with kids like that. And it was pretty fun for me, interesting and fun, because you have to learn how to work around children like that, like getting their deciding what the message that they're trying to convey to you is and how you can help them. And that was pretty useful to me because I want to work with kids in the future. So I and then I've never done a research opportunity, but I know that a lot of professors do research, and there are a lot of research opportunities for SLHS students for those that are interested in research.
That's awesome, guys. I am not involved in any groups this semester. But last semester, I was a part of the Black Diamond Collective group on campus. It was a group that, hosted, young, African American women. We sit around, we just talk about, the culture of African American and, just also being African American, how it is to have an education and be in college. Learned so many things from that. I am in the process right now of trying to find what internship I'm going to choose for this fall. So, it's just a lot of back and forth interviews, reaching out to different internships. So, that's pretty much, what I'm dealing with at this moment.
One thing that all four of our panelists have in common is that they are never free. So once again, thank you to our panelists because all they do is be busy. And in Leilani's case, she's either doing research or she's at the airport, from what it seems. Thank you so much. Our next question, what is something that has surprised you in terms of studying your major?
For studying nursing, especially when I'm in clinical, so when I'm in the hospital, doing hours there and learning, something that really surprised me was how much is really put into patient care. Um, One might just think it's like, okay, maybe just the doctor and then maybe some nurses taking care of this person, but it's so much more than that. Like for example, if I'm just looking at the panelists here, like kinesiology, that's used for physical therapy and then also occupational therapy that helps patients just get back into their normal lives if they've been in an accident, like learning how to maybe walk and or maybe how to dress themselves. So that's super, super important. Speech pathology, that's used for helping evaluate patients if they can swallow and they have a risk for aspiration. And that's super important too. Just we don't want them, choking. We need to make sure that they're like fit to be able to eat. And that's just like super, super important. And also social work. Social work is so important. Like case manager work, social work is so important for our patients too. Because it helps patients get what they need, like the resources and support that they need when they discharge. So there's so much more that just goes into patient care, and just being able to be part of a team like that is just so rewarding. And I just think it's amazing to be just part of a team that helps someone feel better.
For myself, kinesiology has been a major to challenge me in ways that my previous two majors didn't, that being interaction game design and psychology. Kinesiology as a field is cross-disciplinary, multidisciplinary. There's history, sociology slash social justice, cognitive sciences, life sciences, and so there's a lot more effort that I have to put into studying, and it's made it to where I have to really make sure that I'm on top of my time management, make sure that the study strategies I'm implementing are effective, and this has ultimately been a very pleasant and welcome surprise because as I consider moving into grad school, this is all stuff that I need to have in order anyway. So I appreciate kinesiology for giving me that chance.
Um, I forgot to mention one other program I'm a part of earlier, but I'm also part of the aphasia treatment program, which is where we work with typically older individuals who have aphasia. And it's like a condition that affects your communication in relation to your brain after you suffer a stroke. I've never worked with older individuals, so that has been pretty interesting to do. But something that surprised me about my major is how much processes happen for us to even think about communication, let alone having like the ability to speak. Um, so like your airways, having to breathe, like your cognition, like that has been really, really I've had to study a lot to learn them, but it's very gratifying to understand how we as individuals communicate and then can build those bridges with another person using those skills.
One thing that surprised me about social work is how much of it is like connected to system and policies. It's not just like helping people one on one. Like before I was taking my classes, working, like side to side with social workers before. I just thought that social work is mainly focused, counseling or supporting individuals directly. But however, I've learned that social work also involves like understanding laws, policies, into institutions that impact people's lives. Also in how important it is in writing and documentations are in social work as well.
Thank you so much. I could tell so much of the commitment and what you've learned is clearly sticking with all of you in more ways than just for a midterm or for a paper. Speaking of tests and papers, the next question is if a student needs help in a class for your major, what would you suggest that they do?
Um, I feel like in my major, everyone is really struggling. Like, it's such a hard topic. I'm sure all of our classes are like very, very hard. But a good rule of thumb that I've learned to go by is just ask your peers first. Form a study group because the rule of thumb that I've learned is that there's always someone who knows a little bit more than you and someone who knows a little bit less than you. So maybe if you form a study group, the person who knows more than you can teach you maybe what you're not understanding, and then it really helps reinforce it in your brain. But then also, if there's someone who knows a little bit less than you, then it's you get to teach them, and then it's reinforcing you even more. So that's always been my go-to for studying is just being in a group, also doing some like alone studying, but also group studying to help me learn through teaching, but also receiving information from other people. And then, of course, just reaching out to faculty. All of our faculty is so good and being able to sit down with you and really help you understand whatever we're learning, whatever subject that we're learning. And they're always looking to make time for you. If their office hours don't work, they usually offer up some other time that they can meet you. And so yeah, just first ask your peers. They're probably struggling too. But if you work together, you can definitely help learn more things. And then also just reaching out to your teachers.
My suggestions are actually largely a mirror of Hannah's, and so there is very specific things that I can add on in relation to that. Regarding peer support, I will say for a class like exercise physiology, it's very helpful to actually meet with your classmates, speak with all of them, because you're going to want another set of eyes to check your work. I have needed it several times in working through the calculations. And then also regarding peer support, there are on-campus resources, and so one tutoring center would be the SCA. The SCA was very helpful in helping me actually get applied musculoskeletal anatomy down. And with my tutor, she was able to review all the muscles with me on muscle in motion. She regularly tested me. We were able to do a lot of just quiz and exam prep. And so I highly recommend the SCA. In terms of asking a professor, asking faculty, I think if you take the time to practice speaking up in class, whether raising your hand if you need support then, or if you meet with your professor after class or during office hours, that's a great way also for your professors to get to know you and start building that professional relationship. Ultimately, the point though isn't to struggle quietly and to actually let somebody know if you need help understanding a concept. So I would recommend not being shy in that regard and just reaching out.
Yeah, I would say similar things. I like to study a lot with my friends, and we ask each other questions and we help each other out. I personally, I don't prefer larger study groups, so I just keep it to maybe 3 to 4 people personally. Um, if I would also say if it's always good to reach out to the professor. But if you are too scared or intimidated to reach out to the professor directly, if your course has a SI or student instructor, you can always reach out to them and they'll help you out. I've definitely had to do that a couple of times. They SIs usually will relay your message back to the professor, but it's kept anonymous um, and I've never had an issue with that. Usually, my question or whatever issue I had was solved that way. I've also attended my SI, um, sorry, my SI like sessions after class or outside of class, and those have been pretty helpful. SIs are people who have taken the same course that you have before and like, succeeded with like an A or something. So yeah, that's all I have to say.
Yeah, what everyone said. What me and my classmates did. We had started like a WhatsApp chat where everybody go in there and ask certain questions like, "Hey, do anybody know when this assignment is due or how to do it?" It really comes in handy. I personally made good friends. Working closely with my classmates. Shout out to them. We been through the fire. We got it done. It's just like everyone said, you just gotta work hard at your professor, fall back on your peers. Don't be scared to just speak up and ask. That's what everybody is here for.
Thank you, everyone. And a really big theme that everyone was really touching upon is making that effort. Don't be afraid to ask for help because all of the resources throughout all of your majors definitely seem to be really open to asking for help. And if anything, encourage stepping up and asking when you're um, not understanding something. So that's amazing. And then the positive aspect too. One last question before we have to go say goodbye, but let's make it an amazing last question. Looking back, what is one piece of advice that you'd give new students or something you wish you knew before starting your classes in your program?
For me, my big piece of advice is just that rejection is just redirection. The first time that I had applied to the nursing program, I had gotten waitlisted, and ultimately I didn't get into that year's program, and I was super bummed out about it. But I had taken time off school to really focus on studying for our TEAS exam, which you need to take to get into the program. So if I just took some time to really focus in and focus on myself. And then I had actually got into the program the following year, um, which I was super happy about, but also I was able to meet my forever friends in this program. And if I got in the first time, then I would have never met them. Um, but I feel like just knowing that rejection is just redirection, in any sense, is super important to remember. Um, Knowing that any failures that you might feel are just moments that you can rise up from it and learn and better yourself. Um, and I feel like it's a big feeling that happens a lot in our program, where a lot of people feel a bit of imposter syndrome, or they feel sometimes that they're not ready, but it just means that um, usually they are ready, but just taking that leap to really focus on themselves, and knowing that um, they can, if they really, when they really put in that work and they really reach out, like we had said before, it just makes all the difference. And yeah.
Absolutely amazing advice, Hannah, and I'm so glad that you were able to meet your forever friends. That is so wholesome, and it's very good to hear. I actually want to piggyback off of that for the first half of the advice that I want to speak to. And in terms of the point about redirection, I would want I would want incoming students to know that it's okay to not have a sense necessarily immediately starting your undergrad what you want to do. For me, I stuck out interaction and game design for 2 years, and I stuck out psychology for a year and a half before switching to Kin. And I kind of switched to Kin sort of at the tail end of my undergrad career. And ultimately, in making these different redirections, I figured out disciplines that I have more passion for, ones that I have less passion for, and have amassed a community I wouldn't have ever expected. But I also don't think I would have been in a place where I was emotionally mature enough or just really ready to give my all in the ways that I have without having previously done those prior two majors. So, it's okay to take your time. It's okay to trust the process. It's okay to not know immediately and to eventually find your answers. And you'll find your answers in being passionate, even still, ultimately, in the things that you might not necessarily like as much and want to change from, but, invest. And then another piece of advice I have is to please, please, please talk to your professors. The professional and personal relationships that you build with who are literal leading experts within the field that you're studying are going to end up taking you very far when it comes to what might happen after your bachelor's degree. And if you're not sure what your immediate next step will be, the professors are a wonderful resource to just be able to brainstorm possible paths and figure out and identify what actually will work and what won't for you. And this could be speaking to them for a few minutes after class, speaking to them in the hallway if you see them, visiting their office hours, asking questions about the class, explaining your interests, explaining what you'd like to do in the future. Ultimately, it's all fair game, and education is access. So, understanding that your professors are a wealth of knowledge, they're there for you. I say tap in.
I would say when I first transferred into the school and to this major, I felt a great deal of imposter syndrome because the undergraduate SLHS program is largely a mix of transfer students and post-bac students. So um, when I would hear other people speak and kind of already know what was going on in the classes, I felt kind of scared and intimidated. But I like to remind myself that it's okay that I don't know everything about this major yet. And there are elements that I don't already know, and I'm not going to know for a while because this is my first year technically in this major. Um, and that, and that everything that I'm learning now won't necessarily click right away until I become a practicing SLIPA or an SLP or until I get actual experience. So I really need to remind myself that quite often. And so if you're coming into the SLP program, I would say if you feel intimidated because you feel like there's other people who know more elements than you do, just to take a breath and remind yourself that it's okay that you don't know the same things that they do, um, and that it'll all work out. Also, I would like to say that mapping out my exam dates, my assignment dates, the school wide dates, the like when you need to register for classes or payment deadlines, I like to put that in a planner or my Google Calendar so that I know, okay, this is when I need to start studying and create my study guides. This is when I need to think about what classes I'm going to start taking or that I'm going to apply for the next term. That has been pretty helpful. It keeps me in track and kind of reduces my stress a little bit.
I would say, social work, it can be a lot of reading and writing, and that's okay, because me is I learned a lot, and I'm still learning a lot, more things that I thought I knew, and you can use this information that you're getting, to be able to be, a really great social worker, once you get done with school. Like everyone says, is going to be a roller coaster. But you just have to, keep going. You have to just keep moving forward. And once you get there, you're gonna be thrilled, you're gonna be excited, and you're gonna say, I did this, and so just, you know, look and be prepared for your future, and just be happy and thrilled, that we got a chance to be able to be here in college and get the education, from these wonderful professors. Um, I enjoyed, I really enjoyed, leaning on my peers. Again, I made really good close friends, in the social work program, even though, I've only been there, for 2 semesters. um, just lean on your support system, lean on your peers, lean on your teachers, also lean on your counselors, lean on anyone, that's willing there on the campus. And you're gonna do amazing.
I really like that last part. With everyone having a different approach to this, you're all going to do amazing. Well said, Jordan and everybody else. With that, the thing that we're going to do right now is probably go get dinner started. So, with that, I'd like to thank all of our panelists for joining me and to our audience members for tuning in and listening to all of these different perspectives. If any student has any admissions or housekeeping questions, feel free to stick behind. But if not, thank you everybody and have a good rest of your night. Thank you.
You too. Thank you.